Let us review the other conotruncal condition, namely truncus arteriosus, which results from a failure of fusion of the truncoconal ridges. It is a large vessel that arises from the central portion of the heart and has a truncal valve that may have 2 to 6 leaflets. This valve may have normal function in 75% of cases, may be insufficient in 15%, or may be stenotic in 5% to 10%, and agenesis of the ductus arteriosus occurs in 50% to 75%. Perimembranous outlet ventricular septal defect, VSD. We can see a type 1 truncus arteriosus where the ventricular septal defect is visible. And here this large vessel comes out, which would be the arterial trunk. And from this trunk, this vessel emerges, which would be the pulmonary artery. And here we see the truncus arteriosus, which has an insufficient valve. In the 3-vessel trachea view, 2 vessels are visualized, the transverse aortic arch and the right superior vena cava. The truncus arteriosus is the outflow of a single large vessel that will be responsible for the systemic circulation, pulmonary circulation, and coronary circulation. Here we see the typical image of a type 1 truncus arteriosus. We have the truncal valve, and immediately afterward, this vessel appears, which would be the pulmonary artery, which will then give off its branches. This is the type 1 truncus arteriosus variant. Here we see an example in which we observe this vessel arising, overriding the VSD. And after the valve, we will see this other vessel, which would be the pulmonary trunk. Both provide antegrade flow. Therefore, it is responsible for the systemic, pulmonary, and coronary circulation. Here we can see persistent truncus arteriosus. Again, in this case, that valve is insufficient. It is also important to keep in mind that the 4-chamber view can appear normal, so a complete and thorough cardiac screening must be performed in order to diagnose a conotruncal heart defect. Otherwise, it may be missed. Here we see the truncal valve again, and after the valve, this vessel, which would be the pulmonary artery. Type 1 truncus arteriosus. Another example, antegrade flow, a vessel emerging from the center of the heart. In this case, the pulmonary trunk or the pulmonary branch cannot be seen. Here, a large vessel emerging from the center of the heart can be seen more clearly, which in this case was interpreted as a truncus arteriosus. Again, truncus arteriosus. Another example of a truncus arteriosus. A large vessel with a valve that appears to be dysplastic and is overriding the interventricular septum. The pulmonary artery also cannot be seen. The pulmonary artery is not visible as in the previous case. We can see a large vessel or trunk emerging from the center of the heart, and apparently we do not see the pulmonary artery. However, the differential diagnosis may also be a tetralogy of Fallot with pulmonary atresia or pulmonary atresia with a ventricular septal defect. A characteristic feature of truncus arteriosus is that on the 3-vessel trachea view, we will see 2 vessels, the transverse aortic arch and the vena cava, because in this case, the ductus arteriosus is absent due to agenesis of the ductus arteriosus. Therefore, we will see the transverse aortic arch and the vena cava. In this case, with this variant, there was suspicion that it could be pulmonary atresia with aortopulmonary collaterals, because here some distorted vessels with reverse flow can be seen. This is one of the differential diagnoses of truncus arteriosus. Along with atresia with a Fallot type complex, such as pulmonary atresia with aortopulmonary collaterals. We again observe only 2 vessels on the 3-vessel trachea view with anterograde flow in the main vessel. This is a finding highly suggestive of truncus arteriosus. Another example. In this case, suspicious for type 2 or 3 truncus arteriosus, we appreciate a single truncal vessel that immediately gives off a lateral branch with anterograde flow. We do not visualize a pulmonary artery arising at the cardiac level, as would be typical in type I. Instead, it emerges more proximally from the truncal artery itself, which is characteristic of these abnormal variants in which the pulmonary branches arise directly from the common trunk. This is the classification of truncus arteriosus. The most common is truncus arteriosus type 1, where we see the trunk. This would be the case here. And immediately after the truncal valve, the pulmonary trunk arises and gives off its right branch and its left branch. Here we have type 2, in which the branches arise from the arterial trunk very close together. Type 3, in which they arise more distally. And the type 4 variant, where it is seen that the pulmonary arteries arise or the collaterals arise from the descending aorta, aortopulmonary collaterals, but the most common is truncus arteriosus type 1.